Hi friends, my name is Dr. M. Niharika. I'm working as a fertility consultant in Kamineni Fertility Center. Today I will be discussing very basic question when to approach a fertility consultant or a fertility expert. Uh, we all know that infertility is defined as a term where it is defined as people not able to being conceived even after 1 year of unprotected intercourse. So a couple have tried for 1 year on their own and still they haven't conceived. That gives an alarming sign or a necessity at least to get evaluated why they didn't conceive in that one particular year of time. Also, we have to understand basically the process of fertilization and the fertile period time where the couple have to try exactly, because just trying every other alternate day is not sufficient to achieve a pregnancy. The intercourse has to be as close to ovulation as possible. So following few steps or understanding the process of fertilization will help the couple to achieve pregnancies on their own. So basically, we have to understand whether the ovarian reserve or the tubal patency or the semen parameters of the couple are normal. So if a patient is around less than 35 years of age, both the couple, wife and husband, they can try for 1 year or at the max 2 years on their own. And after that, they can visit a fertility expert if they are not still able to conceive on their own. But a patient who is about a wife, especially is more than 35 years of age, should consult the fertility expert after 6 months of trying for pregnancy if they couldn't conceive on their own, or if they are also facing issues of biochemical pregnancies or conceiving but not able to sustain the pregnancy for a period where they can have a healthy baby. So these are the basic things when they require to meet an fertility expert. So as I said, there's a natural process of fertilization. For that, we need an healthy egg, a healthy sperm, and a patent fallopian really, which the incidence of a couple who are trying for pregnancy to get pregnant in one menstrual cycle is only about 15%. So we cannot expect that just because they have tried in one cycle, 100% couple 1 year of time, because if not in one cycle, the other cycle they should conceive if everything seems to be normal. But after 1 year of unprotected intercourse, also if the couple have not conceived, then it necessitates the need for the couple to visit a fertility expert and at least get evaluated with the basic fertility investigations and be categorized into a category where they can where they are having every investigation in the normal terms, or there are any major issues with the wife or with the husband. So the factors that can influence fertility rates in a couple are: age is one important factor, in especially in the female, and the history of the menstrual cycles. If a patient female is having regular menstrual cycles, it warrants or gives us a hope that at least 80% of the time they are having a regular ovulation. But if a wife is having irregular menstrual cycles, even though she has tried for 1 year, that is not a good 1 year because she's not ovulating regularly. Irregular menstrual cycles is a sign that the patient is not ovulating. This is more commonly seen in couple who are suffering with PCOS syndrome. So the simple history of menstrual history itself can help us understand whether the couple have tried in a correct way or given their 100% naturally. So we have to take a proper history of the couple, and then whether she has any previous histories of hormonal imbalances in terms of hypothyroidism or hyperprolactinemia, or she is having obesity, and whether was she evaluated previously with the ovarian reserve test. Ovarian reserve is something that which helps us understand whether the female is able to conceive and deliver a healthy child at any given point of time. So assessing the ovarian reserve in a couple who are infertile is of utmost importance, and this can be done only with a fertility expert. So that is the reason whenever a couple have not conceived, visiting a fertility expert will help them understand their situation, whether they are falling into which category of the ovarian reserve: good ovarian reserve, poor ovarian reserve, and the fertility experts can hence help them achieve pregnancy in a way that they cannot achieve naturally. And also the other important thing that we have to assess the ovarian reserve after assessing the ovarian reserve is to understand whether the female is having patent fallopian tubes or not. Patent fallopian tubes can be assessed by the investigations like hysterosalpingogram, saline infusion sonography, or laparoscopy to the higher extent. So, assessing the fallopian tubes in a less invasive way in an OPD procedure through hysterosalpingogram and saline infusion sonography are quite accurate and help us understand whether the patient is having tubal patency or not. Because if the patient is not having tubal patency, or the otherwise meaning she has some pathology in her tubes, as in the tubes are inflamed, swollen, or they are blocked. In such cases, there is very less probability or almost nil probability that they can conceive naturally on their own. So there again is the requirement of help of in the form of the fertility expert. So if they have already got evaluated outside that they are having any patency issues, then meeting a fertility expert will help them guide to understand the situation and help them with the procedures so that they can conceive a healthy pregnancy. Then after the tubal patency test is the third factor that we assess is the male factor. No doubt, because of the increased disorderly lifestyle and the unhealthy lifestyle that a couple are following nowadays, be it stress from the work-wise or usage of excess of phones and then radiation from the phones and laptops, male factor infertility has increased. And also because of the awareness that the males are having nowadays compared to they used to have around 20 years of time, 20 years ago, where the awareness or stigma to semen analysis was a lot. But now every couple are forward ahead to undergo investigation and get evaluated and understand why they are not able to conceive. So male factor can be ruled out first by history, whether they are having any major issues like hypothyroidism, prolactin disorders, or obesity, hypertension, diabetes, and a semen analysis test. A basic semen analysis test will help us understand whether the sperm count, motility, and the morphology, that is, the shape of the sperms, are in the normal fertility range or they are low. So, if and also not only the semen analysis test, sometimes the males can also suffer from erectile dysfunction or the sexual dysfunction factor. So a detailed sexual history, whether the try that they had done in the last 1 year was proper or not, also helps us understand whether we have given the couple a good 12 months of try. So sometimes people don't have the knowledge of the fertile period or when to try actually to get pregnant. So helping them understand the issues and the factors that they are having in that couple will also require the expertise of a fertility consultant. So when we have ruled out or investigated the couple as a whole and understood the problem, sometimes there might be only one or two minor issues, and a proper counseling to the couple regarding the fertile period and the methods that they have to try, and also helping them understand the usage of the ovarian reserve tests like the LH kits, which help them understand the or when the fertile period is actually open, can also help them understand whether the ovulation has happened or not. Apart from this, if the patient is having irregular menstrual cycle, as in PCOD, giving them minor amount of medication in the form of ovulation induction drugs can help them achieve pregnancies on their own. So, apart from that, as I said, there is a probability where the tubal factor infertility is also increasing nowadays, and because of which the patients are directly required to undergo assisted reproductive techniques. So, whenever there is a tubal pathology, whether there is absence of the fallopian tube or the tube has been removed or the patient has tubal blockage or the swollen tubes or hydrosalpinx wherein water is collected in the fallopian tubes, all these situations where the patient has been diagnosed by either the tubal patency test will benefit with the assisted reproductive technique, that is the IVF. So these people should definitely meet a fertility consultant as early as possible. All come into the category where the semen analysis says that the fertility index is normal, but there are a lot of variations that we see in the count, motility, or the morphology. So if there are only borderline abnormalities that can be corrected through medicines, we help them give medicines and increase the count, and also help them understand the lifestyle changes that they have to make, which can help increase the count. And also, if the patient is having very severe decrease in the sperm count, we can help them with the ICSI procedure, where the sperm is directly injected into the ova and embryos are prepared and help them achieve pregnancies of their own. Also, if the sperm count is nil, there are high-end procedures that called as testicular sperm aspiration techniques, where we can retrieve the sperms directly from the testis and help the couple achieve pregnancies of their own. So, basic investigation is of utmost importance, and hence, people have to consult a fertility expert at least just for evaluation, whether the fertility parameters of both the wife and the husband are in the normal range, or if they are having some pathology diagnosed outside by a gynecologist, they should be referred to a fertility consultant to help them conceive as early as possible and not to waste time. Thank you.